Hello, my name is Julia Espinosa. Today I'm speaking in regards to the need for universal health care in the United States. Health care is a fundamental right for all humans. Health care is one of the most controversial topics in the United States. Health care is one of the most critical issues regarding elections and voting. In the U.S., the socioeconomic status of an individual dictates and determines their access to and even the quality of health care treatment they receive. Shifting the current market-based system of our country to universal health care is necessary both ethically and economically. Universal health care ensures all people have access to health care services including preventative care, health promotion, treatment, rehabilitation, and palliative care. In addition, universal health care ensures Americans do not financial hardship. Universal health care will alleviate social disparities associated with a diverse population of our country. In addition, universal health care will facilitate and encourage sustainable preventative health practices and be more adventurous for long-term public health and the economy of the United States. We are humans, and as a citizen of the United States, we have many rights. One of the most important rights is our right to health care. Former President Franklin Roosevelt wrote the Declaration of Human Rights for the United Nations, addressing health as a fundamental right of all humans. As a result, many countries adopted universal health care systems so all citizens can access care. Hammaker refers to the case of Harris versus McRae, where women's rights to reproductive care is seen as a negative moral right. Women were allowed to do what they felt like is right for them, so the government must provide the access, not the financial means, leaving women to fend for themselves. The United States has historically not acknowledged health or health care services as human rights. The United States has also historically utilized a mixed public and private approach to health care. This approach allows citizens and business to obtain health insurance from private insurance companies, while individuals also may qualify for public government subsidized health insurance such as Medicaid and Medicare. In 2010, the Affordable Care Act was implemented in the U.S., amending how health systems and insurance work to improve care, price, and quality. The Affordable Care Act is a health insurance law, not a health care law enacting a universal health care system. The Affordable Care Act decreased uninsured and reduced health care spending for our nation. However, many citizens still lack health care coverage, leaving their illness to progress due to no treatment or care. Individuals with no health care coverage are 3 times more likely not to receive preventative health care screenings or treatments such as routine physicals, blood pressure checks, and women's exams, to name a few. Without this, the chances of adverse health consequences become more likely and increase over time with continued lack of service. Many in our country oppose a universal health care system. One of the most powerful arguments in the United States is that we cannot afford to pay for the coverage of every citizen in our country. Another argument is that the system will be manipulated and abused more than it is now with our current health care system. Preventative measures are in place to reduce over and underutilization with copays, deductibles, and services. Universal health care will increase the ability of patient care and allow for more data to be gathered, so improvements and adaptations to healthcare innovations can be made, revolutionizing healthcare practices. Equality of opportunity and justice is the American ethics that universal health care focuses on. Ensuring all citizens have equal access to health care and costs are covered for those who cannot afford it. Americans have the right to coverage and equal access to care to eliminate the disparities and improve the overall health of our nation.